It's now my pleasure and privilege, and I'm honored and thrilled to introduce our next speaker, the AAP CEO, Mark Del Monte, who has graciously agreed to be our keynote speaker this year. Mark has a JD degree and serves as the CEO, Executive Vice President of the National American Academy of Pediatrics. In this capacity, Mark leads a strong chief executive team for the organization, which serves over 67,000 pediatricians, pediatric medical subspecialists, and pediatric surgical specialist members. Prior to this role, Mark served as the AAP's chief deputy and senior vice president for advocacy and external affairs, where he directed the organization's communications, public relations, and advocacy activities. Prior to joining AAP in 2005, Mark served as director of policy and government affairs for the AIDS Alliance for Children, Youth, and Families, which is a national organization advocating for children and families with HIV/AIDS. Before moving to Washington, D.C., Mark worked as a lawyer in his home state of California, providing direct legal services to HIV-positive, low-income children and families.
Hello, everybody. Can you hear me?
I'm sorry that kind of left you hanging there. It is my privilege to introduce Mark Del Monte. And for those of you that have not heard, Mark, he is, as you will learn, a very engaging, entertaining speaker, and it's going to give us an update on federal advocacy that the Academy has been involved with. Mark, welcome.
Yes, Chris, thank you, and don't raise the bar too high for me. I'm giving you an update in the middle of something unprecedented here. I'm thrilled to be with you. I hope you can see me okay and that the background is okay, and we're doing some sophisticated Zoom stuff today. I have a bit of time to spend with you, and it looks like the slides are a little jumbled. Do you see that the same that I do in the title? Let me see. Let's go to the next one and see if this will write itself. I'm Mark Del Monte. I'm the CEO of the AAP. It is a great privilege to have this role at this time. It is quite fitting, actually, to think about celebrating the 90th anniversary of the American Academy of Pediatrics in this context. The organization was founded, and as we think about 1930, the Spanish flu wasn't very far in the rearview mirror. War was certainly present, and all the ravages of war, childhood poverty, a great recession that had followed a depression. And so there were very, very difficult times at the turn of that century. And out of that difficulty and challenge came the American Academy of Pediatrics. And so that gives me some perspective. As we sit here 9 decades later in the midst of our own unprecedented layer upon layer upon layer of challenge, the idea that we are a part of a movement that began 90 years ago, that indeed the creation of AAP with the vision of a group of pediatricians, pediatric medical subspecialists, and pediatric surgeons aligned in common cause around the nation to advocate for children and provide the very best in healthcare possible as the solution to the problems that our founders experienced in the early part of the decade actually gives me tremendous comfort that we are holding the baton and dealing with our own tragedies and challenges, but we are part of a larger and longer movement. And so decades from now, they will look back to see what we did during these very difficult moments and hopefully learn some things in positive ways, in ways that we address this pandemic. So I think this is a difficult time for the country, difficult time for the global community, but it's a very momentous time in the history of the Academy of Pediatrics and the history of the profession. So with that grounding, let's just jump right into the political update. In addition to the pandemic and everything else, we've just had the strangest election period that goes on and on and on. This sort of 24/7 reporting of every vote, reporting of all the key states and states in play around the country was an anxiety-producing event. Ohio was certainly in the center of that, no doubt about it. My goodness, every time a vote was counted in Ohio, Michigan, Wisconsin, Georgia, Florida, Arizona, Nevada. We heard about it. And so I love this cartoon. Anxiety leads frustration with fear and apprehension still being counted. This is a lot to be going through. And it seems like all of us sort of believe that this was a very high stakes election, that this was consequential in our lives and the lives of our children's families and communities. And in fact, we were not alone in that. Next one. Most Americans thought that this election was very consequential. Look at this chart of the last 20 years of voting. And this is polling data, the percentage of registered voter who say it really matters who wins the presidential election. So going back to 2000, really close, 50% of the people said it really matters. 4 years later, people thought more about that. Obviously, September 11th had happened in that intervening period. And then year over year, you see that curve starts to climb. And in 2020, 80% of registered voters said that it really matters, that it's not just a difference between Republican policy and Democrat policy, but something much more consequential, something much more important. And I think that is a good indication of exactly how fraught this election has been, no matter what side of the political spectrum you find yourself on. And that feeling is represented in the results. Next one. Look at this. This is the voter turnout as a percentage of eligible voters. In the 2020 presidential election, 66.4% of eligible voters voted. We have not seen this number since 1900. Remarkable. To me, this is staggering. On both sides of every issue, people were highly motivated to go out and vote. And record number of Americans in total vote count voted, but a remarkable percentage of people eligible to vote voted. I think that validates for us that for those of us who felt like this was really high stakes, we weren't alone. A lot of Americans felt like this election is really, really high stakes and consequential. Next one. And if you want to just advance all the way through the animation, that might be easier. Thank you. So here's some key 2020 election takeaways. As I said, historic engagement of voters across. I didn't even talk about the amount of money spent by both sides. This was an incredibly, by every measure, money spent, voter participation, voter engagement. This was historic levels. It's now clear that the Democrats will retain the majority in the House of Representatives, even though that majority has trimmed down a bit from previous years. The Senate is in a remarkably close place. The two Georgia Senate races will be in a runoff on January 5th. All eyes will be on Georgia. All energy around this election has now focused on Georgia. And just today, Georgia was certified election results as the winner being Vice President-elect Biden and Vice President-elect Harris. And so that gives you some indication of what will happen in the Georgia Senate race, but it doesn't by any way mean that it will be the same result. Obviously, it was really close. They have a lot of candidates in both races, and so we'll see what happens. Polling again failed us. Every poll that we saw expected a blue wave across the country, that this would be a historic win for Democrats up and down the ballot from the president all the way on down. That did not materialize. More people were comfortable voting Republican than were voting for reelecting President Trump. But the Republican Party down ballot was very, very successful. Existing incumbents outperformed their polling, both on the House and Senate side and on the GOP and Democrat side. And so now we have to ask ourselves, how do we poll? How do we go into a national election and have any indicator of what the American electorate is thinking, given the confusion in the polls both this year and 4 years ago? And so Americans, once again, have picked divided government, it looks like. Either, no matter what happens in the Georgia race, it's going to be tight. And so that's historical. And so Americans like to have a legislative and executive power divided across the parties. I think people believe that it tends to moderate policy. And so here we go. We will begin in January 2021 with a very different environment. Next. The way the Academy of Pediatrics participates is to lay out the gold standard for children. What people expect from the nation's pediatricians is to articulate the best and most important in child health, and we have certainly done that. We started doing this in 2016 with the Blueprint for Children. We repeated the blueprint prior to the election results so that both sides would have the benefit of the best expertise in children and what needs to happen. And now that we have a result, we have issued a transition plan for the Biden-Harris administration. Both of these documents are web-based. We're trying to be modern about that, not printing things. So aap.org/blueprint is our overall guide, and aap.org/transition is the clear set of instructions for the Biden-Harris administration. Next. I'm excited about the blueprint. It is more than 140 recommendations across 27 issue areas. It covers the entire gamut of child health and wellness, and it is organized into the same domains that the blueprint is organized into. So we talk in terms of healthy children, and that includes access to care, vaccinations, children with special health care needs, reproductive health, tobacco, keeping kids away from tobacco, including electronic cigarettes, mental health and substance use treatment, pediatric workforce initiatives, American Indian and Alaska Native children. Also then moving outside the bullseye of kids to the next ring of strong communities. Environmental health, of course. We could produce an entire transition plan on global climate change and the impact on children that will occur if we don't do something about the changing climate on this planet. Gun violence prevention, which is increasingly for us becoming about suicide prevention among youth. Suicide is very efficient when there's a gun involved, and with continuing concerns about children's resiliency and mental health, that risk becomes more and more acute. Obviously, all of our work about health equity and racism, the needs of lesbian, gay, bisexual, transgender, and questioning youth, across that whole spectrum of concern. The violence against young people who are sexual minorities is on the rise, as well as their health and safety concerns. We've got to focus in on those populations. The need for childcare across all children, appropriate housing, particularly in this pandemic-induced recession, and disaster preparedness response, whether it's man-made disasters or weather disasters, hurricanes on the Gulf Coast, fires on the West Coast, and drought in between, really, really tough stuff. And then family supports. So how do we create child welfare systems and foster care systems and basic nutrition programs that support families who have worsening child poverty as this recession takes hold? Federal policies like family medical leave, which support caregiving for children and for relatives, injury prevention and product safety. One of the things that's been very true across our history at AAP is injury prevention. That has been part of it from the very, very beginning. The needs of children and military families, of course. And then what is our role on the global stage with respect to children? And national COVID-19 response, of course, immigration. We need to reimagine our immigration policy with respect to children at the border, certainly, but also physicians and visa holders who are trying to come to augment our workforce or learn medicine here in the U.S. Children around the world need our attention. We need to re-engage with the World Health Organization. And then finally, broader comments about reimagining the respect and primacy of scientific-driven policy and evidence-based public policy making, focusing on research and then the implementation of research-based interventions. It's been a very dark time to think about the role of science and scientists in this moment. Next slide. So we have communicated all of those priorities that you'll read at aap.org/transition already to the Biden-Harris transition teams. They have stood up a website, a Twitter handle, an Instagram feed, and all the rest. They don't have offices yet. They're waiting for the ascertainment from the current sitting federal government to do that. But they are already on the move, and so we are not waiting. Last week, Dr. Sally Goza president of the AAP, sent a message to all AAP members, letting them know that we were now ready to engage with the Biden-Harris transition. And we wrote to them on November 10th with a delivery of that transition plan, and most importantly, our offer to help. It is very important that pediatricians be engaged at every level of government, but especially the federal level. We do well when pediatricians are in high office and in the administration agencies across HHS, FDA, CDC, HRSA, NIH, SAMHSA, all the rest. And so we offer our assistance both substantively and in personnel as they're beginning to fill out their cabinet. That gives me a chance to just sort of make a general comment. If any of you are interested in being in the Biden-Harris administration and are working towards that, please let us know. We want to keep track of all of our members who are doing that and be supportive wherever and whenever we can. I think this period is going to be difficult, especially with respect to COVID, because the Biden-Harris administration is standing up a response, but they're not in charge of anything. And they won't be in charge of anything until the middle of January. And so that is a key problem. I'll say more about COVID, of course, in a few moments. So this difficult and challenging election, this very divided electorate, this polarized environment that we find ourselves is one important context as we think about advocacy. We have to understand the environment that we're in, and that there's a whole group of people who are going to be deeply disappointed in what happened in the elections a couple of weeks ago, and there's a whole group of people who are going to be very excited about what happened in the elections. And as I showed you the very first slide, there's not a whole lot of people who are ambivalent about what happened in the elections. And so this is a very polarizing moment into which we are trying to make child health policy. And I think that really speaks to the importance of pediatricians as individuals and experts who are so good at translating science and evidence into plain language that's compelling for families. This is what pediatricians do every day. They're very good at taking out the polarization, taking out the heat, and just communicating effectively about what's best for children. And in order to do that, we have to understand kind of where we are as a country with the pediatric population. I think there is a disconnect between what people think children, who people think children are, and who children actually are. So let's look at the next slide. We have relatively new census data. This is not census kind of from the current 10-year census, but annual census data that is from the Bureau based on 2018 data. And if we look at the U.S. children, there are about 73.4 million children in the U.S. This number has remained relatively stable for decades. So as a percentage of the population, it might be changing, but the absolute number of kids in the United States is about the same. The makeup of that change is also, the makeup of that population is also changing. So about 1 in 4 children in the U.S. was born or has a parent who was born in another country. So without immigration and that 25% of the population, the number of children in the U.S. would absolutely be declining because the birth rate for U.S. citizens is going down. Half of all U.S. children are a race other than white or non-Hispanic. 26% are Hispanic or Latinx, 14% are Black, 5% are Asian, and 5% are other. That's mixed race or did not report. And so that is a remarkable number, that 1 out of 2 kids is not a white kid. And I think that it may be a surprise to many, not to pediatricians, because you know who your patient population are, but I think in the popular notion across the country. 1 in 5 kids, 20% speaks a language other than English at home. 1 in 6 children live below the federal poverty level. The federal poverty level is abysmally low as a number, $25,465 for a family of 4. And that's 1 out of 6 kids. And so if you get that number up to what a true poverty level is, that is having enough income to cover your expenses, it's much higher than 1 in 6. And then about 4 in 10 kids are covered by public insurance. That's 40%. Over the last 20 years, the proportion of uninsured children has gone down and down and down until the last couple of years, when we were really down to less than 5% of children in the U.S. uninsured. Since 2018, that number has ticked back up. We're very worried that that curve is now going up. especially as a result of the pandemic-induced recession, but it also is a result of policies that are pulling up the welcome mat for families in Medicaid and for CHIP. And so this is important to understand as a backdrop for policy development across the board. Next slide. And so here's just an extraction of the children of Ohio. 9% of kids in Ohio are from immigrant families. 17% lived in households that were food insecure at least one point during the year. 24% are from families that received public assistance. 25% live in households with high housing cost burden, which is defined as more than 30% of monthly income going to housing. And then if you look at children in poverty, you can see that the highest percentage of children in poverty is the 0 to 5 group, but the highest number, of course, is the total. So this is a snapshot of Ohio. It mirrors the national percentages, but there are some changes. Next. So how do we engage? The Biden-Harris presidential transition, as I mentioned, has already stood up. They have begun to put together their teams. This is a really fun time. Often can be fun when, or maybe it's not fun to anyone but wonks like me. Maybe I should take that back. This is an interesting time when we change transitions. Typically what happens is that the new administration, the incoming administration, sets up transition teams. So they identify key thinkers and leaders in a particular field, and then they send those teams into the agencies across the federal government to sort of take a survey of what's going on and look at positions and people and policies that may be of interest to the administration. President-elect Biden has already named his transition teams for HHS. We're already engaging with them and working with them. They're a group of thinkers that, fortunately, many of whom are known to us, and there are pediatricians among them. And of course, the ones that are focusing on HHS agencies, CDC, FDA, NIH, et cetera, are of primary focus to us, but we have interest in lots of aspects of the federal government. You can go to this website and take a look at what's already happening, who is engaged in the transition, and get involved if you know people who are already on that list. Next one. This is a list of the priorities that they have already identified. This is not surprising, and it is nice to see that it overlaps with the domains in our work plan, transition plan, and blueprint. So obviously to focus on COVID-19, all the aspects of the pandemic and response, economic recovery, racial equity, and climate change. Next one. And with respect to COVID in particular, the first thing that the new incoming administration announced was a COVID-19 advisory board. So you can see that Dr. David Kessler, who was a former commissioner of FDA and a pediatrician, and Dr. Julie Merida, who was former health commissioner in Illinois, Chicago, and is vice president at the Robert Wood Johnson Foundation, are two pediatricians who are involved in this effort. And so that's good for us and for kids. And so we'll keep an eye on that. Next one. As I mentioned, they have already established their agency review teams. And so you can see on that website a list of everybody. And if you have interests beyond HHS to other agencies, all of the rest of those are up there as well. So that is the new incoming administration side. Let's talk a little bit about Congress. Next one. We still have a little bit left to go before the new Congress is seated, and so they are in session. This is a hard slide deck to make right now because the prospects for the lame duck Congress are changing by the day as an increasing number of Republican senators are being diagnosed with COVID-19. So Senator Chuck Grassley was diagnosed earlier this week. Senator Rick Scott was diagnosed this morning, as far as I can tell. And so they're having trouble getting enough senators into the chamber to be able to conduct business. And that's unfortunate because we have lots of business to conduct in the next few months, even as, next one, please, even as there is some indeterminacy about what happens next. I mentioned the Georgia races. Let's see if we can advance. There we go. These are the two incumbents on the left. These are the two challengers on the right. And I think the entire lame duck session that we're in right now is colored by this race. Every senator in particular is thinking about policy actions that the lame duck Congress will take under the guise of how will it impact positively or negatively the race in Georgia. So they are going to try to do nothing that helps the Democrats be successful against the incumbents. They're going to do everything that they can think of in the Senate to support the work of the two incumbent senators. And so unfortunately, what that means is it looks like there is little that is going to happen, which is unfortunate because we have a lot to do. Next one. Let's just assume for the moment that the incumbents are successful in Georgia and that there's a thin, razor thin majority for Republicans going into the next Congress. This is the first time a newly elected Democrat president has started his administration without a Democratic-led Senate since 1884. So President Obama had the trifecta, Democratic Senate and House. President Clinton had a Democratic Senate and House, and you can see Carter, Johnson, Kennedy, Truman, FDR, Wilson. So it was way back before this had happened again. And so, there's a historical trend here that's interested in worth watching, but there's also a moment in time because either outcome could occur. Next. We would like to see them get to work. We need additional COVID relief for all sorts of reasons that are clear to you. Practices in pediatrics and in adult medicine, hospitals and health systems are hurting. They are still hurting, and even those that are not affected directly as frontline providers in hospital systems that are dealing with individuals who are sick with COVID, they're having practice losses, and then everyone else is being overwhelmed with infection control and PPE needs and then acute care. So we need much more resources from the federal government to provide relief to healthcare workers and healthcare systems right now, not to mention ongoing needs for families and nutrition support, unemployment, continuation, housing and eviction delays, all of that has to happen. And so it's challenging for the process to be interfered with by politics so much. It's frustrating to watch close up as advocates. In addition to the additional COVID relief, there's still appropriation bills that need to be done. They're working on them. They need to pass them. They're bipartisan, House and Senate. We need to get them through the process and onto the president's desk. The National Defense Authorization Act is still pending out there. That has huge implications for TRICARE in particularly and care of children in military families. Maternal health, there's some good bills pending on reducing maternal mortality and promoting prenatal care that we'd like to do. And then there are a whole package of things that we call extenders. This is like community health centers, child care tax credit. They just need Congress to continue those programs. And so that politics is interfering is a problem. Next. And in the lame duck session of the current administration, we are watching because we think that this current administration, President Trump and his team, are going to try to cement in their legacy. And this is not uncommon at the end of a presidential administration that they do a whole bunch of things and oftentimes the incoming administration rapidly reverses them. But there are things that this administration is trying to do right now. We are watching several of them. One is it looks like they are trying to finalize Medicaid waivers that we would oppose and other Medicaid regulations that we have fought against in courts and the like around work requirements and measures to reduce roles through barriers to access that are completely unacceptable. We anticipate a round of executive orders. We're particularly worried about executive orders with respect to immigration policy that would make the situation for kids on the border worse. The children on the border are still there. Many of them are on the southern side of the U.S.-Mexico border, and they're not getting a lot of headlines these days, but they're still suffering there, and we need to stay focused on that. We'll see, the administration had a press conference yesterday, the COVID response team, mostly focused on doing nothing until the vaccine comes, which we obviously don't agree with. And then, as I mentioned, we're going to see if the administration is willing to collaborate with Congress to get those fiscal 2021 spending bills in. Next. And then, of course, we will get to the 117th Congress in January. They're going to find their footing, but they're both in a lot of transition. This has been a consequential election, as I mentioned. So there are new senators from Colorado, Arizona, Alaska, Kansas, Wyoming, New Mexico, Tennessee, and as I mentioned, possibly Georgia. We'll see what happens there. So that always changes the makeup and energy. This freshman class of senators, as well as the freshman class of House members, always change the dynamics a bit. As I mentioned, there's a smaller Democratic majority in the House. This was a good year for Republican women. There are the most Republican women ever in the House of Representatives. And whenever there's transition like this, there will be a switching and swapping of the gavel over various committees. We're watching House committees and Senate committees alike. The Senate committees are likely to be in a little bit of flux until Georgia is settled down. But we do already know there's been a leadership election and process in the House already, so that's starting to come into focus. Next. So what will the first 100 days look like? Will it be just more gridlock, more rancor, more partisanship, more difficulty, or is there a chance for real bipartisanship, for some productivity in the process? We, of course, would hope that we can, now that the election is over, settle down and get back to doing some legislating. There certainly is a giant agenda. If we can't get anything done in the lame duck, by the time January comes and we've had another 2 months of this horrible and growing pandemic, we're going to need a lot more. We want there to be immediate reinstatement and protection for the DACA kids. We think that can be done by the Biden administration almost immediately. Senate President-elect Biden has already signaled that he will re-enter the Paris Climate Agreement and re-engage with the World Health Organization. And then we'll see what happens with the president's new cabinet. Historically, the Senate has granted tremendous deference to presidents to pick their team. There has already been some murmuring and soft-spoken language that if the Republicans remain in the majority of the Senate as the cabinet members are being confirmed, they might take a different look at cabinet members, and they might make their own decisions about whether they think that the cabinet members are not just competent and qualified, but politically appropriate. And that would be a new threshold, and so we'll be watching out for that. And then immediately, we're not even done with this election. You've already heard talk of the 2024 election, presidential election, starting to talk about that already. And we'll be posturing for the 2022 midterms, obviously, if there's a chance that Republicans believe they can retake the House or that Democrats believe they can keep the House and retake the Senate or vice versa. And so politics will definitely intrude. Next. We have had lots of television commercials and discussion, and the seating of Justice Amy Coney Barrett was dominated by discussion of a Supreme Court case called California versus Texas, which once again has constitutionality of the Affordable Care Act in front of the United States Supreme Court. There were oral arguments last week. We are part of a briefing for that court with a lot of medical groups, including the AMA. And I can tell you, and this should be the most comforting thing I'll say in the whole talk, that listening to the oral argument, it was boring and legalistic and only of interest to lawyers like me. It was a somewhat tedious discussion of the jurisprudence around whether or not you can strike down parts of the bills that are unconstitutional or the whole bill if one part is unconstitutional. This is jurisprudence of severability. This is something that law students and lawyers like, but almost no one else should care about. And it's a good thing. When the Supreme Court is focused on a narrow legal issue, that means that that we can rest easy. I don't anticipate that the Affordable Care Act will be struck down in total. The individual mandate may be struck out as a provision, but it has largely had the teeth taken out of it anyway. And so the rest of the Affordable Care Act is likely to be intact. We won't know about this until next June, but I think basically everyone heard the same thing during the oral arguments. And so this debate is likely to settle down. So let's go on now to what we're doing. In the next slide, let's talk about COVID response and advocacy for that in the coming days. I hope that you all saw, next one, our press statement and alarm this week as we announced that we had crossed the threshold of 1,039,000 children that have been officially diagnosed with COVID-19. This is part of a count that only AAP has been doing for months now. We have been surveying public health departments in every state and in other jurisdictions like DC, Puerto Rico, and New York City to count the diagnoses in children. We're the only group doing that, and we've been watching that trend line go dramatically up over the last couple of weeks. We were sort of hovering at 37, 35, 34,000 over the course of the fall, and then we spiked to 50,000, then 70,000, and last week was 107,000 cases. We are in trouble here, and the number of kids is becoming stable at about 10 or 11% of the overall diagnosis in the country. So when you hear the national counts, think about 10 or 11% of those will be pediatric populations. Next one. After our major announcement, we have some clear priorities going forward. As I mentioned, we need financial relief to pediatricians. This is not over, and it's not going to be over, and we need to do something about that. I'll say more about vaccines in a moment. Medicaid programs, this is the time when Medicaid and CHIP increase because the economy is declining. So we need funding from the federal government to shore up state Medicaid and CHIP programs. We need to help schools stay open, and that just takes money. In order to revisit the physical plant, hire different and new staff in order to clean and to separate kids and support transportation to and from school, there needs to be more resources on the table. This is a problem of resources, not anything else. So we need funding. Obviously, we were concerned about mental and behavioral health issues before the pandemic. It is an emergency now. We need to continue to engage in all the issues that the killing of George Floyd and the reckoning around Black Lives Matter has put to the forefront for us. And in any recession, we worry about nutrition supports for kids, and especially those who are not in school, since most kids get most of their calories in school, and immigrant families, as I mentioned before, we need this as this is the total panoply of pandemic response. Next one. We also need basic things like PPE paid for. The code has been created, 99072, to cover PPE. We need this code valued and paid right away. We have helped chapters by developing a template letter to be sent to state Medicaid directors. I hope that you have that in Ohio. We'd be happy to work with you and your Medicaid program. Next. Sally Goza, our president, continues her media blitz, talking everywhere. This is just this week on CNN to raise the alarm. And in terms of all the policy issues I just mentioned, but also the vaccine issues that are now squarely in front of us. Next. We have written to Operation Warp Speed and have sounded the alarm in the media that while there are positive indications about the Pfizer and Moderna products, those look good, at least from the outside and the press reports that we can read and the evaluation that our infectious diseases experts have done, it's time to get kids tested. We do not want to see products licensed only for adults once there's appropriate safety and efficacy data in children. And Pfizer has begun age de-escalation studies in its products. Moderna has not. Next one. And so we need to get that going. It is important to think about that right now. So the risk and benefits must be evaluated for all subgroups of kids. We need very significant data transparency on this and huge investments in the existing public health structure of vaccine providers. We want to hear from the Advisory Committee on Immunization Practices at CDC and other entities. It's time for Operation Warp Speed to pay attention to pediatric populations at this moment. We were joined by all sorts of medical groups in our broad call to action. Next step. So how to help you as we navigate all of this and start into this next phase of advocacy with a change in administration and a new Congress in the midst of all of this pandemic and racial strife and the rest. We've put together a few things we hope you'll find helpful. Next. We have been updating our COVID-19 response advocacy report monthly. We're on the 6th edition now. That gives all of the state and federal activities that we're engaged in. So this gives you an immediate background for that. You can get our Capital Checkup, which has the latest advocacy data. Just email kidsfirst@ap.org if you're interested. We will have a virtual conference in April. That registration link is opening soon. I hope you can join us. One advantage of being virtual is that we have no limit on, so anybody who wants to be part of it can. Next slide. And we'll be working with you to make sure that as state resources contract, it doesn't affect Medicaid. Medicaid cuts always happen in recessions, just when Medicaid needs the money the most. So we've got lots of work to do there. Next. And we have chapter-specific resources as well. So there are advocacy action guides on any number of topics: physician payment, the impact of uninsurance, increased cost sharing effects on access, and how enrollment and eligibility changes can reduce coverage. So please take advantage of these things. Next one. And then if you'd like to take on our blueprint or look at other chapters who have, we have templates for everyone. Lots of chapters have used that domain structure for their own state advocacy, and so we offer that as an opportunity, and we'll be happy to work with Ohio to get that done if you're interested. Next up. And then as you're thinking about virtual advocacy in this moment, you know, we're all struggling with that. People had Capitol Hill days. They were very successful to take over state capitals in white coats. And so moving those to virtual, we have a planning guide available to folks because it's just different. And there are ways to be successful. We've had some success in doing that, but we have resources for you in that as well. So that was a big overview. I hope it was somewhat on target. There's lots to cover and think about, and I look forward to taking your questions. Thank you very much for the chance to come. And by the way, whenever we get back in person, I'd be happy to be with you the next time your meeting occurs together. And thanks so much.
Thanks, Mark. That was a phenomenal update. I'm just blown away at what the federal advocacy group for the Academy is doing. So thank you for just sharing some of that. And you know, I just want to make a comment and just you're showing that picture of Sally Goza. You know, the Academy has always been there for the health of kids, but I cannot remember a time in my 25 years as a pediatrician where the Academy has been there on the front lines advocating for pediatricians in practice like they have in the last year, whether it was, you know, getting the word out about PPP loans, the advocacy that the Academy did in that first round of relief that went to Medicare providers but not Medicaid providers. You know, I really think that those of us that were able to benefit from that money, that was directly from a result of the advocacy that the Federal Affairs Group and you all did. So thank you. And I just, you know, you didn't show the picture, but I just think that picture, that iconic picture of Sally Goza back from the spring where she's at the White House talking about COVID and she was the only one wearing a mask. And I think that just really sums up sort of the bulldog effort that all of you and Sally especially have done. So thank you very much. We do have time for a couple of questions. One question, it really involves sort of what to look forward to with the new White House administration and the new Congress. So I'm gonna ask sort of two different issues. So first off, Mark, what do you think the most likely changes in healthcare coverage and access may be with the new administration and Congress? And then the second part of that is, you didn't address this at all, but I know you've been doing a lot of advocacy around the recent mandate from the federal government that overseeded the state's dictates on pharmacists being able to give vaccinations to kids 3 and up. And do you think there's any chance that that will get rolled back in the next administrations?
Thanks so much, Chris. I'm assuming that you're giving me another hour to answer that question. Let me try to take that in parts. So first of all, we are likely to have divided government or closely divided government. And so I think sweeping change and another Affordable Care Act or some similar is likely to be off the table, which is okay. I think we can be successful in any environment. So let's take these in parts. The administration, it's hard to overestimate the difference. I think, if we can have a CMS administrator who is a deeply committed advocate of the Medicaid CHIP programs, that wants everybody who is eligible for those programs to be able to access those programs, that is a powerfully different approach. And so I'm not making a partisan comment. I'm just saying it has been the hallmark of this administration in many agencies to have leaders of those agencies who are deeply suspicious about the work of the agencies that they were running, because there was a philosophical belief the government was too big and doing too much. And so for our perspective, to have federal officials who are eager to work with us about how to get every child who is eligible, every family who's eligible enrolled in Medicaid, I'm just picking one example, is a game changer of an opportunity. So positions really matter. The cabinet matters, and the heads of these agencies matter. And there has been a huge brain drain in federal agencies in recent years. And so rebuilding the capacity and intellectual depth at some of these agencies, like the EPA, for example, is going to be very, very hard work. And so we're going to need to be able to influence that and to be a part of that. And so I think that's very important. We will no longer see executive orders saying that anti-racism training is itself racist and we should stop doing that. Those kinds of things, or to be constantly on the defensive around immigrant children and trying to protect their safety. So I think there's some things that have been really hard work of AAP over the last few years that will just change because this new administration has already signaled they have different policy in some of these matters. So I think that cannot be overestimated, and our ability to engage with them will be very different. Out of the Congress, I think Joe Biden is a very different leader than Donald Trump and certainly even Barack Obama. His 30 years in the Senate has made him a bipartisan deal maker. And so I expect a different posture from the White House with respect to Mitch McConnell or Chuck Schumer, whoever's the majority leader, and Nancy Pelosi. And so I think this is a president who is going to be more eager to legislate than write executive orders. And so I think that will be a different dynamic to watch in the federal government. And then the pharmacy administration of vaccines. This is an open question for me. I think this administration has been very friendly and open to the approach of the chain drugstores. And you're seeing a very important role of the chain drugstores in COVID-19 vaccines, right? They've already talked about how they're going to be a primary administration site. And that's probably wise. They give out a lot of flu shots, and a lot of people who need to be vaccinated in the first round are going to be adults. But the idea that that's the only place, or that we should shift vaccine administration from pediatrics offices to chain pharmacies, it's a terrible destruction of the medical home. And we will continue to stamp our foot and pound the table and tell everyone we think that. So this was an overuse of the Public Health Emergency Act that we think we have a good legal argument there, but by the time you're done fighting that out in the courts, it would be 10 years from now. So we're going to fight really hard to reinforce the primacy of the medical home in vaccine administration for children.
Well, Mark, again, thank you very much. You are more than welcome to stick around. We're about to have a state update. So if you have some time, stick around. If not, we will see you.
Please.
And thanks for all that you do and Tamar and everybody in the Federal Affairs Office does for the kids. We really appreciate it.
Well, thank you, and happy virtual Thanksgiving, everyone. I hope you have a safe one on Zoom and wherever you're eating over the internet with your families. Take good care.
Thanks, Mark. Have a great weekend.